This is an untreatable, rare neurological condition that causes one hand to function on its own and start doing things involuntarily, with the sufferer feeling everything but being unable to control his own hand. The affected hand usually does goal-oriented tasks like picking up objects or grasping onto door handles, and not just random involuntary movements. There have even been some cases where the alien hand started choking the sufferer, to the point of having to use the controllable hand to restrain the alien one. Medically known as congenital central hypoventilation syndrome, sufferers of this condition lack the function of the autonomic nervous system that regulates breathing, which causes them to have to consciously remember to breathe. In order to survive, most victims have to be hooked up to ventilators when they sleep. The disorder is pretty rare, however, it can easily be fatal if untreated. This rare condition causes the bones in the inner ear to lose density, which results in having a very sensitive hearing to the point where sufferers hear the inner functions of their own bodies. In one case, a woman would hear her own eyeballs moving from side to side inside their socket, and she would even hear the sound of her blood coursing through her veins. Her condition, in fact, was so bad that when the phone rings, she would hear it so loudly that her eyes would shake from the vibrations. Luckily, the condition is treatable by surgery. Little is known about the causes of sleep paralysis. However, this condition occurs during the transitional state between wakefulness and sleep, and it causes people to find themselves awake but unable to move, all the while having terrifying hallucinations, such as a stranger being in the room with them or lurking outside the window, and it usually results in some of the most intensely terrifying experiences. This condition mostly affects the eyes and skin. Sufferers tend to have extreme sensitivity to ultraviolet light, to the point where less than 3 minutes of sun exposure would cause them severe sunburns and extreme freckling. Their cornea would also become cloudy and their eyes hazy, bloodshot, and irritated. With no treatment available other than avoiding the sun at all costs, nearly half of the sufferers start to develop skin cancer due to sun exposure by the age of 10. This condition is caused by skin tumors in the form of horns. They tend to grow on people with fair skin and are composed of the same material found in fingernails. Most of the horns are benign and are usually removed through surgery. This rare sleep condition occurs when a specific genetic mutation activates, and it gradually causes the patient to lose the ability to sleep. With no treatment available, those affected tend to slip into a half-dream state, and as their insomnia increases, they start to have panic attacks, paranoia, hallucinations, rapid weight loss, dementia, and ultimately death. Medically known as genu recurvatum syndrome, this condition causes the knees to be bent backwards, resulting in severe knee pain and creating an animal-like posture. However, depending on the severity, the condition can be treated through surgery and physical therapy. This condition is caused by the filarial worm. The microparasite enters the human body through the bite of a deer fly and can crawl beneath the skin undetected for years until it finds a good place, like an eye. Treatment of this condition usually involves chemotherapy and surgical extraction of the worm. This psychological condition causes otherwise healthy individuals to intentionally cut off their own limbs or blind themselves because they feel they're meant to be disabled. In 2015, a woman suffering from this disorder intentionally blinded herself by pouring drain cleaner into her healthy eyes. And when asked about it, she said, "When I had my sight, I didn't feel right. I really feel this is the way I was supposed to be born, that I should have been blind from birth."